So you may have had your mastectomy or lumpectomy, and now you're wondering what next. Both what's going to happen in your post-op appointment, and if you had active breast cancer treatment prior to your surgery, what is life after breast cancer expected to be like? Let's talk about it. If you had a lumpectomy, these things may still apply, but just in case I'm wrong, go ahead and look in the video description below for links to support groups so I don't leave you hanging and so you can get the right information for you. Like I say often in these videos, everyone is on their own breast cancer journey. Not every breast cancer journey is the same. There's so many different types of breast cancer and so many factors that go into your active treatment that might be different than mine. Before I go any further, this is what we're going to talk about in this video today. We're going to talk about what to expect at that post-op appointment, and then what you can do in your life after breast cancer, basically active breast cancer treatment, to help improve your chances of thriving. First, I want to talk about what to expect at these post-op breast cancer appointments. Yes, I said plural because most likely you're going to have more than one type of. Obviously, you will follow up with your breast surgeon. As with any appointment for your breast cancer journey or any medical appointment, always bring any questions or concerns along with you to address at these appointments. You should be respected as a member of your care team because this is your body, this is your journey, this is your life. Just like with my breast cancer journey, this is my body, this is my journey, and this is my life. So if your care team is not including you as a valid member of your care, then I suggest that you seek a better care team because they should respect your position on your care team. If you have pain on your affected side, this is usually normal, but still bring that to the attention of your oncology team because they may be able to do something to help alleviate some of that pain for you or suggest some things to help alleviate the pain. Usually that pain that you're feeling is your nerves trying to reconnect, and it's a kind of sharp shooting electric pain. It should get better over time. Mine personally did get better over time. I had to breathe through them, but they would come really suddenly and then leave just as suddenly as they arrived. At your breast surgery follow-up, they will most likely discuss your pathology results. And from there, this is where a lot of these other appointments come from. It depends on what your pathology findings are. Now, this is an example of how everybody's breast cancer journey is different. I was diagnosed stage 3 hormone positive. I was diagnosed stage 3 because I had a 7.5 centimeter tumor, and one of the sentinel nodes in my arm was found positive. So they automatically went ahead and administered 4 rounds of adriamycin and Cytoxan and 12 rounds of Taxol to shrink the tumor and to hopefully eradicate any signs of breast cancer in my lymph nodes prior to my surgery. And because I was stage 3 and they already found cancer in that sentinel lymph node prior to my surgery, they took out all of the lymph nodes in my arm. Now, everybody has a different number of lymph nodes in their arms. They took out 11, and that was every single one of the lymph nodes that were found in my arm. 4 of them still had traces of cancer, very minute traces, but they had found traces of cancer in that right arm in 4 lymph nodes, very minute traces. So I was referred to a radiation oncologist to do 30 rounds of radiation for one of my personal next steps. So that is one of the appointments I had post-op. You may not need radiation. You may not have any cancer found in your lymph nodes at all. Or you may have further treatment like chemotherapy. You may have had chemotherapy prior to your surgery, and you may have it after surgery, both, depending on the type of breast cancer you have. I believe that if you were diagnosed triple positive, most triple positive breast cancer patients are given chemotherapy both before and after their surgery. Correct me if I'm wrong. Share in the comments your experience if you had triple positive breast cancer and that was your journey, or if it wasn't. Same with triple negative. They may give you chemotherapy before surgery and after surgery. But in my journey, one of the referrals I was given was to go to the radiation oncologist next. Our breast cancer journeys are all different. Please consult the video description below for links that I'll provide for support groups so that you're not left hanging and so that you get the information that you should have for your personal breast cancer journey. There are other people in these support groups that I mentioned below in the video description who can help you that have a similar journey to what you're walking. One thing that we are probably all going to have in common is that you're probably going to get a referral to a physical therapist post-op. This is to help you recover your range of motion on your affected side or sides, especially if you had lymph nodes removed and especially if you had a mastectomy. This physical therapist needs to be someone that your oncologist refers you to, because this particular physical therapist or team of physical therapists needs to be specialized in lymphedema. This is so that they reduce your chances of developing lymphedema over time, especially if you had lymph nodes removed. There are some other referrals that you may be given at your post-op appointment, but I want to stop and talk about things that every appointment usually has in common before I go to those things, because those referrals are things that you usually end up asking for or you're provided in your life after breast cancer. So when you go to your post-op appointment, they're going to examine the surgery site to make sure there aren't any signs of infection. They're going to check for seromas, which are pockets of fluid that can cause issues, that could cause infections if they're not addressed and managed properly and caught on time. They will also check your drain output. I talked about the drains in the prior video. And if there is enough output record and there's very little output in the drains at your appointment, you may have at least one drain removed, or maybe even all drains. Like I said, every breast cancer patient is different, but you may or may not have one or all drains removed at this post-op appointment. It may be at another subsequent post-op appointment that they remove those drains. But every single post-op appointment, usually they will examine you to make sure everything looks okay, and also check your drains, and you may or may not have one or all drains removed at this appointment. If your breast cancer was hormone positive, like mine was, your breast surgeon will most likely refer you to your oncologist, your general oncologist, to discuss hormone blockers with you. So now, what should you expect if your surgery pretty much marked the end of your active breast cancer treatment, or a majority of your breast cancer treatment? Let's talk about that next. One of the referrals that I strongly encourage you to ask for is to speak to a therapist, a psychologist, because breast cancer treatment can be a big deal, especially if you were hormone positive. I strongly suggest you talk about your emotions, because it may not just be emotions, it may be a chemical imbalance or hormone imbalance, and your body is adjusting to that. But it also could be psychological. All of these should be addressed, because your care team could help alleviate some of these issues for you. I know in my personal breast cancer journey, I was hormone positive, and I took a huge dive in my hormones. And so I was a crying mess. Every time I turned around, I was crying about the littlest things. Now, granted, I did have some circumstances going on in my life, not directly related to breast cancer, that were making me depressed. But it is no wonder that I was depressed, having a deep dive in my hormones, and also finally getting a chance to look back and see what I overcame through my journey. Anyone would be depressed with that. So if you're feeling thoughts, emotions that are you're feeling devastated, you're not alone, and you're not crazy. You're not alone. A lot of people identify with this. Don't feel ashamed to talk to a therapist or ask for a referral to speak with a therapist, and also ask your general oncologist if there's some medication that you can be on to help you to adjust to all of this. Another reason to talk to a therapist is that sometimes some of our bad habits that we brought into this breast cancer journey that may have been a cause in some way. I'm not saying it's your fault, but I'm saying that sometimes we carry along trauma, we carry along bad thinking habits that need to be adjusted, need to change to help us manage our lifestyle in our life after breast cancer. Sometimes some of the mental things that we keep telling ourselves cause us to have bad habits. And if you're trying to feel empowered and take control of your life after breast cancer, you're wanting to improve your staying active with exercise, and you're wanting to improve your diet and create good habits, sometimes we have to address our mental health in order to stay steady with those improvements in new healthy habits. So that's another reason to ask for a referral to a psychologist or a therapist. Now, most of the care teams out there don't usually volunteer this information. But if you want to really take charge of your breast cancer journey and improved health in your life after breast cancer, then I strongly encourage you to ask for a referral to a dietitian that can help you eat healthier in your life after breast cancer. I'm going to share at least two links to books that are recommended to help you take charge of your diet in your life after breast cancer. You can refer to them in the video's description below. So what can you expect in your appointments in your life after breast cancer? We're going to talk about that in closing up this video. Let's get started. You should expect that you're going to have a physical exam at least once a year, but up to 4 times a year. During your first 5 years in your life after breast cancer. It may depend on the diagnosis that you were given, as well as your age and some other factors. So I can't get into it because everybody's breast cancer journey is different. After those initial 5 years in your life after breast cancer, you will usually visit at least once a year. I personally have been meeting with my oncologist twice a year, but you may be graduated to seeing your oncologist once a year after that 5-year mark. Again, it depends on your personal breast cancer journey. If you had lymph nodes removed, it's encouraged to keep an eye on that. And if you see any signs or symptoms of lymphedema coming on, then address that with your oncology team as soon as possible. Don't wait until your routine appointment is coming up. Let them know as soon as possible so they can get that addressed, because the sooner it's addressed, the less likely it's going to take over your life. Because if you wait too long, it may be harder to manage that lymphedema. If your family's breast cancer history changed since your active breast cancer treatment, let your care team know. Even if you had genetic testing done during your active treatment at some point, if it's been several years, there are new gene mutations that have been discovered over the years. They keep finding new ones. So if possible, go ahead and discuss with your oncology team this update in your family's breast cancer history, and see if you need to go ahead and have additional genetic testing so you can update this information. If you still have some breast tissue left, or you had a SMX or single mastectomy, then you'll most likely have annual mammograms. But if you had a double mastectomy, and also if you had reconstruction, you'll most likely just have physical exams once a year. This is so that they can better catch early signs of recurrence or metastasis. Now, if you had reconstruction or you had a double mastectomy, there aren't usually any scans that they give you unless you have signs or symptoms of potential recurrence or metastasis. So make sure if you have some concerns and they're persistent concerns, to address them with your care team. And don't wait until your routine appointment is coming up. Let them know as soon as possible. As soon as it's bothering you and nagging you, let them know so that they can check this out. Because if they catch metastasis or recurrence early, it's better managed and the prognoses are better. If you had anthracyclines in your active breast cancer treatment, for example, things like adriamycin cytoxin, aka the red devil, then it's recommended that you meet with a cardiologist routinely or once in a while to monitor your heart health. This is especially important if you have a history of heart disease or heart problems in your family. If you're going to be on hormone blockers in your life after breast cancer, the screening that you have depends on the type of hormone blocker that your oncologist prescribes for you. For example, if you are prescribed tamoxifen, then you will most likely have an annual gynecological exam to check and make sure that everything is okay, because sometimes tamoxifen can cause gynecological issues that you can discuss with your oncologist. If you are given a Arimidex, then you most likely will have biannual bone density tests to make sure that your bone health is healthy, and they will probably prescribe you something to help with maintaining healthier bone density. These are also called DEXA scans. They're usually done every other year until you're off of that Arimidex. This concludes this video. But if you are living in life after breast cancer and you feel that you're just your care teams kind of just left you to your own devices, feel free to go to the video description below for support groups that specifically support you in your life after breast cancer, because you don't have to do that alone either. You're never told that life could ever get this way. This bill's a joke, you're broke, your love life's to your weight. This journey feels like you're in second gear, where it hasn't been